All right. Well, welcome everyone. Thank you so much for tuning in. We see some more participants funneling in, and we'll get started in just a second. I'm Dr. Jordan Tate out of Atlanta, Georgia, one of the founding members of WIPM Society, and excited to round out our series. This is our third installment of our WIPM webinar series, Mentorship in Motion. So if you've been along for the ride and traveling with us, you know that we got started by giving wings and taking flight with our mentorship in our first webinar. And then last time we were focusing on shifting and changing gears and pivoting throughout your course as a mentee mentor. And now we're going to talk about solidifying mentorship. I'm excited to have with me, as always, Dr. Kiran Patel, and then our special guest tonight, Dr. Alopi Patel. Ladies, introduce yourselves.
Hi, for those of you who don't know me, I'm also one of the founding members of WIPM, and super excited to be doing this webinar series with my colleague Jordan Tate and all of our guest speakers who've come through. I think it's so important in our space, and I think it's really one of the cornerstones of what WIPM is really all about. Excited to just have this conversation with you all tonight. I'm a director of pain in New York City. I'm a fellowship director in New York City as well.
Hi, my name is Alopi Patel. I am an interventional pain physician at Rutgers Robert Johnson Medical School and RWJ Barnabas in New Brunswick, New Jersey. I've been a part of WIPM for about 3 years, and I'm very excited to be a part of this webinar and talk to everyone about mentorship.
The Drs. Patel, I'm very excited about this evening that we have planned together. And we want to thank our sponsor, SPR, the makers of the Sprint product, peripheral nerve stimulator implant device. And we'll be hearing from them a little bit later. This is us. So here's our agenda for the evening. We're going to take a few moments to review where we came from. It's the best way to know where you're going. And so we're going to do a look back and get Dr. Alopi Patel's kind of review of the last two Mentorship in Motion webinar series. So she can give some pearls on how she took off with mentorship and how she's made some pivots and changes and where she's landing the plane today. And then we're going to do a little deep dive with Dr. Alopi, and she's going to really let us know a little bit more about her passion and purpose and profession that has transformed into a pelvic pain practice, and how mentorship has played a role in that, and how she anticipates being a mentor in the space and continuing to have mentorship as a mainstay in her practice. And then finally, we're going to just put in a little plug for the final installment of this series. We'll kind of wrap it all up on the Sunday session at WIPM. So hopefully everyone on the call is anticipating next month's annual meeting in Scottsdale, Arizona. It is not too late to sign up, but the rooms are going fast. So if you have not already, visit WIPM Society webpage and make sure you get your slot. So without further ado, Dr. Alopi, I think you had mentioned that you were able to attend the first webinar. Am I correct in that?
Yes, I did attend the first webinar where Dr. Kiran Patel and Dr. Jordan Tate did a wonderful job setting the tone for what mentorship means and how we as women can support each other in this space and beyond. And also, while pivoting our careers, oftentimes the journey of our professional lives is often impacted by our personal lives, whether that is fertility, infertility, pregnancy, postpartum, menopause, any sort of health-related issues or personal-related issues that impact us can also impact our profession, which may create the need to pivot in our careers as well. And there's nothing wrong with that.
So if you can think back to when you were a fellow coming out into practice, can you give us any pearls on seeking mentorship in the space, looking at other males or females in the space as mentors. And then as you've gone through your career, when you felt that transition where you were able to take on the role of mentor yourself.
Absolutely. So I feel that the word mentee and mentor are fluid in terms of how we can be a mentee and how we can be a mentor, and we can be both, right? We can be both a mentee and a mentor depending on the stage of life or career that we may be in. So initially, when I was transitioning from being a fellow to an attending, I was definitely seeking mentorship. I had sort of decided by the end of fellowship that I had found my passion, which was women's health and specifically pelvic pain, but my fellowship didn't necessarily train me for treating these type of patients. So I was turning to other people around me, whether this was other physicians in academic institutions, other physicians in the pain world or physiatry world, other attendings, just in terms of, is this the right decision? There were some attendings that said, oh, you have no idea what you're getting yourself into. Like, trust me, you don't want to see these types of patients, which was also disconcerting because I felt like I had found something that really resonated with me and I wanted to create a change. So I was seeking mentorship for, is this the right career trajectory? But also as a fellow, I was also able to mentee other people, be a mentor to other mentees, excuse me, who were wondering, should they even go into pain fellowship? And as an anesthesiology trained physician, I feel like there's always a sort of misunderstanding initially about what pain physicians do. So when anesthesiology residents were trying to decide what type of fellowship to do, pain is so different than all of the anesthesiology-based fellowships that I was trying to mentor other people who wanted to come into the pain world. So that relationship is constantly changing. And I did turn to people around me for those answers. And who we turn to can change. Initially, it can be our colleagues. I turned to my attendings in fellowship initially, and I got a varied response. But there was this one attending who I distinctly remember at graduation, for a fellowship graduation, said, and we were talking to my husband and I, he was talking to the two of us, and he said, you have the personality for it. And just because they're challenging doesn't mean that it can't be done. And that really resonated with me. And it was something that I didn't see in myself until somebody saw it in me and said, this is something that you can do. And you needed somebody, sometimes you just need someone to plant that seed of an idea that you can do it. And then you have to build the confidence. So I sought mentorship with other people and asked questions. And oftentimes there wasn't much of an understanding of how to treat pelvic pain patients outside of traditional sort of pudendal nerve blocks, neuromodulation, and my practice evolved over time. My colleague and co-fellow Mira Caretaker and I were able to start our practices together and navigate a lot of these challenges together, and we mentored each other. And initially, when we didn't have many people to ask questions to, we said to ourselves, fake it till you make it, fake it till you make it. That confidence will come one day, and it did. So as you said, Jordan, when do we feel that transition? It takes a few years. I would say at least 5 years from at least from my perspective as an attending, it felt like, okay, now I can like really feel confident about speaking and doing things as an attending. So that's kind of like how my journey with pelvic pain started.
Yeah, I think it's really interesting. You touched a few times on the idea of, the informality of the mentee mentor label and how that can fluidly change. And even within a relationship, at any given point, one can be the mentor and the mentee simultaneously, and, really work to give each other advice. You also, talked about some of your co-fellows and some of the other women in the space that you leaned on, and the old philosophy of high tides rise all ships is, you working together to get everybody on to a higher ground together was a really beautiful sentiment. Thanks for sharing that. So on the second webinar, we went through pivoting, and I know in your personal journey, you've also made some changes with your more recent employment and position and everything. And did you lean on mentorship and guidance through those pivots as well?
Absolutely. I definitely turn to the people around me. Oftentimes they were women. That doesn't mean that, we have to turn to just women, but I felt like women were able to understand a perspective of leaving something that's very comfortable and something that's known versus charting new territory. Also the fact that going through personal sort of timelines at the same time as your professional timeline. So for me, that was going through pregnancy, postpartum, another pregnancy, postpartum, all while navigating my career. And I'm very passionate about my career. So it's not like I necessarily wanted to take the mommy route or the mommy track. And I hate that term because, we're all if you're a parent, it's not, necessarily just a mommy track or a parent track. We're really trying to figure out work-life integration. So anyways, I wanted to continue my career. I didn't necessarily want to take a step back, but I wanted to figure out how I can do both, and turning to other women who had been through those types of timelines and transitions was very important to me, but still keeping true to my purpose and passion. And that was one of the reasons that I felt that I had to pivot, because I knew I was getting to a point in my career where I really felt that an impact could be made. And my institution was very supportive, but I felt like I needed a bit more support in creative direction and the ability to expand. And I found that in this institution where I'm at currently. And it's been great so far because it's valued and it's nurtured. And now I have mentors who are also male, because now most of my mentorship is not just personal navigation of childbearing and parenting and all of that, but now it's more of like, okay, I've had my kids, I'm done having kids, and I'm back to focusing on my career. How do I do that? And for me also, it was the fact that I didn't do neuromodulation. I did one trial my entire fellowship, and then I went to workshops, and I've worked with Jackie Weisbein at those workshops, Kiran Patel, Jordan Tate, like all of you guys were at those workshops when I was a fellow. And even leaving fellowship, after going to those workshops, I didn't feel comfortable to take it on, but I thought, okay, I'll learn as I go. And then I got pregnant pretty much within a couple of months of being an attending, and I didn't go back into exploring neuromodulation. And it was pregnancy, COVID, pregnancy, all within like 4 to 5 years. And I didn't get into neuromodulation. And now at my current practice, my colleagues are very supportive of me to learn neuromodulation, to be able to help and scrub in and mentor me as their colleague, and even a couple colleagues who are younger than me in training who are mentoring me to regain that familiarity with neuromodulation, and like coaching me, like, you can do it, it's okay, and we'll help you if you have questions. Like, and mentorship comes in many different forms, right? So even though they're younger than me, in terms of their years of training, years out of training, I still feel comfortable to look at them for surgical sort of feedback and all of that. So that was another thing. And that's where I have also pivoted my career to now, 7 years into being an attending, turning back into neuromodulation to complete that breadth of my practice, where I'm able to walk them through lifestyle modifications, medication management, trigger points, nerve blocks, all of the traditional stuff. And now I can walk them through the last part of neuromodulation. And I've pivoted to include peripheral nerve stimulation as well. And SPR has been phenomenal in my in integrating into my practice, for starting with steps that I feel comfortable with, and then being able to grow my neuromodulation practice as well. So multiple pivots throughout my career, and that's just a part of life, right? Knowing how to not let something get us down, but learning how to adapt to it.
I think that takes a lot of courage to make that kind of pivot. And I think that's really inspirational. And I really appreciate you sharing that with our audience. Particularly, it's intimidating, right? Feeling like you had a gap in your training, right? And now you're going back to it, and to make it more robust. But how beautiful is that you are bringing the strength of your institution and your support system around you, and certainly the WIPM, the support system, but also your local institution. So I think I applaud you for that courage and for sharing your story, because I think that's so inspirational. Like, we all get bogged down in this idea that it's linear, right? It's like, I do my residency, I do my fellowship, and then I go into my practice, and that's who I am. But the truth is, it doesn't have to be so linear. And just because maybe a few people ahead of you did it that way, doesn't mean it has to be done that way. And so I think it's beautiful that you've done that. And I think that, we've spoken about this many times, both on the board level, but then also, just individually, Alopi, about how SPR is really, our peripheral nerve stimulation can be an excellent gateway therapy to really, kind of take that step and move beyond some of the, more essential therapies that we offer patients for pelvic pain. So I think that's fantastic.
Yeah, I don't think that's an uncommon story at all for women in our space, to have felt like, childbearing or pregnancy and wearing lead and doing high volume advanced interventional procedures, was very challenging. It wasn't accommodating in a lot of location spaces, training institutions where you could, take breaks to be a nursing mom or, make sure that you got your fetal badge without having to tell everybody. I mean, there's all these different stories about how it's very challenging for women of childbearing age to really dive in head first into an advanced neuromodulation practice. It can be done. It certainly can be done, but there's a lot of women who perceive or experience those real and perceived barriers. And so many women in our space will say, I'm going to put that on the back burner for now, or I may never get around to that. And I'm going to, transition my practice to doing perhaps more clinic-based skills or things like that. And so to your point, I think that resonates with a lot of women that say, maybe now I feel like I'm ready to engage in neuromodulation. And number one, it's never too late. Number two, there's always mentors and teachers who can bring you back into the fold, who can help you develop that confidence and the competence to perform the advanced interventional skills. And I think it's a great option to look at peripheral nerve stimulation as that gateway, as you mentioned, to tiptoe, put your toe in the water and see if it's a good flavor for you and your practice. Do we want to take our break now since we're talking about SPR and run our little spot that they've prepared for us? And we're back. I hope you guys all got a chance to see Maudie Schnurr on your screen there during that commercial, this little feature of her. She's also one of our founding board members at WIPM and is a proud user and KOL for SPR and has been very innovative in the peripheral nerve space. Alopi, can you tell us a little bit more about how you're utilizing peripheral nerve technology in your pelvic pain patient?
Yeah, so the way I incorporated SPR into my patients was very organic. It was, again, like you said, kind of dipping my toes in the water, so to speak. It was almost like a natural progression. So I have like a whole sort of foundation of how I work patients through their pelvic pain management. And at some point, as we're on that continuum of management, it does come down to injections. And then after injections, there's this gray zone of, do we go to SCS? Do we go to DRG? And I couldn't offer those myself. And yet, as I was still kind of getting comfortable again, but PNS was something that I do feel comfortable with, right? So it's essentially a peripheral nerve block that now it's ultrasound guided peripheral nerve block. You can obviously do other types of procedures, but most of my procedures were ultrasound guided, which I felt comfortable with, and then putting a wire in, and then something non-surgical initially. So it was a natural progression of being able to help maintain that continuum of being able to help patients who had pudendal neuralgia or ilioinguinal neuralgia to place something like a peripheral nerve stim to help for that temporary time period, and then neuromodulate the nerve. And then if they needed to, there are other options, but it really is a great gateway therapy, as you mentioned, on that continuum.
When patients have these stimulators in place, are you encouraging a lot of physical therapy associated with it, or is it patient dependent?
Patient dependent. I really advocate for good PT in the beginning of before we go down the neuromodulation route, especially internal PT. So for most pelvic PT and abdominal pelvic pain is a very wide diagnosis, as we know. So if it's pelvic floor related pelvic pain, then internal pelvic PT is a mainstay for most of this pelvic pain treatment. And then for other types of treatment, they can continue, but it is something that I tell patients to continue as long as it's not going to change their wire placement. But again, that's an evolving part of my practice to see if that's something that we have to be cautious about for patients who have the PNS in place.
And can you share with us the types of outcomes that you were having with pudendal nerve SPR and also or ilioinguinal and hypogastric SPR?
So to be completely honest, I have not placed one for pudendal nerve just yet. I have for TAP, but I haven't for pudendal nerve. We're still working a couple patients too that it's okay, you can do it. I had a couple patients who wanted to do it and then backed out just because they were afraid of stimulators and whatnot. So we're working a couple patients to that part of it's okay, you can do it for pudendal nerve. But I think patients with abdominal pelvic pain that would like it for the TAP, it's easier for them to kind of have, usually ilioinguinal neuralgia is unilateral. So for those patients, unilateral wire, one or two leads even feels more simple than somebody with two different stimulator wires in the gluteal region. But it's not something that is out of the question.
So I love this conversation because I can just feel your passion for these patients and for pelvic pain kind of jumping off the screen. And I think that leads into the next conversation about the 3 Ps. Do you want to explain what you were thinking when you brought this up to us?
Yeah, so a few people have asked me, like, how did you end up here? What did you do? And I know it sounds very simple, but I feel like this is like our family sort of motto, like just do what you love and everything else will follow, right? Like just do what makes sense and what you like to do, and success will follow. And that's kind of what I've done with my career. I didn't think I could do pelvic pain until that seed was planted. Then I thought, okay, now I have to learn like a whole area that I wasn't really focused on in fellowship. But I was passionate about it because I knew that these patients needed a voice, they needed treatment, they needed empathy, they needed validation. And there was an article that just came out in JAMA about vulvodynia, vestibulodynia, and medical gaslighting. These patients really want to be heard and validated on top of, everything else as well. And I followed my passion, which was wanting to help. Initially, I wanted to help women, but then I realized that, wait a minute, and that's that pivot again, right? Pelvic pain is not just in women, it's also in men. And then my career pivoted again, where I was like, okay, I also have to understand how to engage with male patients who feel stigmatized and uncomfortable talking about things like orgasm, erection, ejaculation. So again, I had to pivot and learn how to navigate another territory, but I knew that patients with pelvic pain were undertreated and didn't have all the tools that we could offer them widely available. So I followed my passion, which gave me a sense of purpose. Multiple times I felt like I could have burnt out in my career, whether that was postpartum. I mean, with my first pregnancy, I really had pretty bad postpartum anxiety. It was hard for me to go back to work and, feel like my mind wasn't still at home, or, so it gave me a sense of purpose that, I'm here because I'm making a difference. And it was just meant to be, in the sense that it seamlessly meshed into my profession. I was grateful to be able to be in a position where I can make that impact, follow my passion, which fulfills me and gives me a sense of purpose when I go to work, and tie all of those in. And that's the Japanese concept of ikigai on the next slide. And I remember when I first saw the concept of ikigai, I was like, oh, that is it. That is what we all kind of aspire for in our careers or in our lives, right? So it's when your passion, your mission, your vocation, your profession interlap, and that's called ikigai. It's a Japanese concept of like finding purpose and peace in your life. So doing what you love, doing what the world needs, what you can get paid for, because we still need to get paid for at the end of the day, and what you're good at. And that is the ultimate blessing, to be able to follow that career path.
Do you feel like you have found that already, or you're on your way there? And
That's a
if
great
you're
question.
not there yet, what else do you need to get there?
That's a great question. And I feel like I found a big part of it, but I can only do justice if I keep evolving for my patients, to know that, if there's anything else I can learn or do. And I tell this to my medical students who rotate on the medical student pelvic pain elective. There is no like nice little box for pelvic pain. Like, who treats pelvic pain? Physiatry, colorectal, GI, urogyn, urology. And even if it's musculoskeletal pelvic pain, which is, what I treat, even in musculoskeletal pelvic pain, who does the trigger points? Who does the Botox? Who does the suppository management? A lot of people, even if they're urogyn, don't feel comfortable with suppository management or Botox. So being able to navigate that in an area where there's so few physicians, you have to constantly self-reflect and learn and ask questions and be on top of the literature, because there's no algorithm, there's no society just for like this area of pelvic pain. So a lot of the conferences I go to are like, sexual health, urology, gyne, and pain management and pain medicine conferences, right? Because everything kind of overlaps. So I feel like I found my purpose, and it's going to constantly evolve to be better in terms of how to be able to keep being good at it and doing what the patients need.
I think that's fantastic. The fact that you're pulling outside of the scope that, many of us would traditionally look at, right? Like people within our field who are board certified in the same exact fields, or, board certified in pain, which may be multiple specialties. You're looking outside of that. And I think that's really important in terms of understanding that there may be mentors that evolve like outside of the space that give you so much that you can bring back in and add to your patient care. And that's a really important takeaway.
Yeah, I mean, I do a fair amount of pelvic pain in my practice, and I have found that the pelvic floor physical therapists have been amazing mentors in the space. Obviously, just from, the leaning on them for assistance with diagnosis and identifying, difficult anatomy, but, and also in partnership and treating the patients. But really just like social media, for example. I follow a lot of pelvic floor physical therapists on social media, and I'm always learning from their pages and from their insights. And whether they know it or not, I look at them as mentors to help guide my practice. And it's not uncommon that I'll see a complex pelvic pain patient, and then something I recently saw posted will be of assistance in developing their care plan. So I agree, mentors are everywhere, and you have to be open to receiving the information. I think we all have to recognize that we're constantly evolving in our careers and in our space. And it's fun to be flexible and pivot and not be stuck in this linear box of, well, this is what I learned in fellowship, so therefore it's the only thing I'm ever going to practice. So I think you are what the world needs, and I think you're really out there killing it. So thank you for sharing all of your story with us. Kiran, how do you feel about this ikigai? Are you there? Have you achieved?
I think we all, we've kind of alluded to a bigger concept of this about, right, the things that fill your bucket up and the things that empty it. And I think you know, we talked about all aspects of life, right? We talked about touching on this in your professional life, your personal life, your just, you know, big, hairy, audacious goal life, right? The things that you want to push yourself to do in your wildest dreams, right? And I think, Alopi, you're doing some of this stuff. You're in terms of connecting medical care to kind of common stream, mainstream culture, right? I mean, making pelvic pain a conversation. So I think I applaud you, Alopi, for doing this, but I think this is something that is evolving and we all can take from this, whatever phase you are in your career, whether you're just starting, whether you've been doing this for a long time, or whether you're somewhere in between. I think this concept of Ikigai, of being practical about it, right? Because you do have to make a living, but the things that truly blend and do justice to your passions and your training and where you want to take your training.
So in the minutes we have remaining, I do want to encourage everybody to put any questions in the Q&A box because we will spend a few minutes at the end going through those. You know, one of the things we wanted to touch on is the Sunday at WIPM. I mean, we hope you're attending every day at WIPM and coming to the Cadaver Lab, which is going to be absolutely amazing, the APP course. I feel like I need to break out and go see some of those lectures because that agenda looks amazing. And then on Sunday, we're going to kind of unpack, you know, the year in review with the mentorship series and then a look forward for the next year. But one of the things that I think could be helpful if anybody that's in our participant pool has attended all 3 webinars, if you can kind of think back to where you were before the first webinar. And if you had to, you know, write a letter to your past self at that time, you know, what advice would you give that woman who, you know, pre-life-changing webinar series, you know, what have you learned? What have you taken away from this? And if anybody wants to share in the Q&A box now, you can. If you actually want to formally prepare this and bring it with you to the annual conference and share that with the group, that would be amazing. I think, you know, myself personally, I think I had always had this very concrete, sort of formalized thought of what is a mentor, what is a mentee. You know, when you first come out of practice, you're inherently a mentee. You don't have the expertise or knowledge or confidence in the knowledge. You have, you know, imposter syndrome galore. And so you're seeking mentorship and you're seeking it typically in a very formal capacity. You're wanting to know how you can ask somebody to be a mentor, how you can secure a good mentor that's really going to understand your station and the things that you need. And so in order to get there, we learned, you know, we talked about the fact that you really need to do some self-introspection. What is it that you're looking for in a mentee mentorship relationship? And, you know, that was something that I never really thought about, right? It was always just, I need to get to the next step. I need to figure out how to get there. So I need a mentor, right? Like this very concrete, sort of linear, formalized thought process of how this all worked. And I think for me, what I would really take away from this webinar series has been the idea of fluidity, the idea of motion. I think we, you know, we kind of got it right by naming this mentorship in motion. I think, you know, I learned a lot about the idea of pivoting, of shifting, of looking to your left, looking to your right, looking ahead of you, looking behind you in that temporal way, and recognizing that there's mentors and mentees all around, and that it's really more of a web as opposed to a pairing in a formal way, and that at any given point in a relationship, you can represent both. That we have a lot to learn from each other. We have a lot to share. So to me, this has been a very impactful journey that has really transformed the way I think about mentorship in this space. And so thank you, Kiran, for being my partner in this. How would you craft a letter to yourself from a few months before?
I think I've certainly learned a lot from this. This whole experience, Jordan and I, we came up in a time, and me earlier than you, because I'm older than you, is that where there weren't too many women in the space. And not to say that our mentors need to be women, and that's totally true, but when you come up to a place where there aren't too many women, right, it's very intimidating. And so we kind of didn't really have we didn't have this way of like, okay, these are the things I need and I'm going to get my needs met. We were kind of just trying to make ourselves fit and try to swim upstream at the same time. And so asking these questions of what guidance would I give, and in an environment where there are mentors available, what would I say? What would I say to say, like, okay, think about big picture life, right? Because I've said it to ad nauseum to you all, which is like, we run toward the best college, the best medical school, the best residency, the best fellowship, the best first job. But what does that mean? As you move up that chain, you are able to choose to design the life that you want. And a lot of it is the concept of ikigai that Dr. Alopi Patel shared with us tonight. And very basically speaking, what are the things that fill you up and what are the things that empty you? And so I think at any point, I encourage you all to continue to ask yourself that every step of the way. If you find yourself feeling, lost, if you find yourself feeling, missing something, take a step back, take a moment. And what are the things that you're feeling in the moment? But also, what are the things that you want to feel? And what are the things that you're missing, like the gaps? And that could be professionally, that could be work-life balance, that could be, just work personalities, navigating that. So I really think what I've learned is about asking questions of ourselves, which are going to be different from person to person. And even myself, when I find myself like, oh man, today was tiring. Like, why do I feel this way? Okay, like, what are the things today that happened that like really drained me? And what are the things today that really like were the peak of the day? I think even reflecting on that on a daily basis has made a difference. And I do that with my trainees as well. How was your day? What are the things that made you feel good today? What are the things that drained you today? And I think it's important to ask those questions for those of us who have trainees, to get them to start to introspect and to look at their emotional compass. So this experience with you, Dr. Tate, has been fantastic. And with all of you in the WIPM community, kind of talking about those things and being really honest about, just navigating the space, which is a different journey for every single person.
Alopi, how do you feel about solidifying mentorship as a mainstay in your practice? That is our title slide today. Do you feel like it's something that you are able to do now that you've gone through your journey? Is it something that you need? I'm thinking about the word solidify. What does that mean to you? Is that something that you need to have a label on? You need to have a formal mentor as you go, forward from here? Or is it something that you're just going to adapt and pivot throughout life? How do you feel about that concept of solidifying mentorship?
Mentorship is necessary, I think, throughout our personal and professional lives. We may not call it mentorship, we may call it friendship, we may call it a vent session, right? And then somebody gives you feedback after that vent session. But either way, it's that communication of how to navigate things, which can come in many different forms. It can come in the form of colleagues, it can come in the form of people who are older than us, it can come from people who are younger than us, it can come from our patients. Especially for my practices in pelvic pain, because I was navigating things I had never done before. Some of my patients knew this was the first time I was doing something on them. And I was very honest with them of like, this is my first time doing a ultrasound guided pudendal nerve block. I've only done fluoro guided. And my patients were very understanding. Or this is my first time doing a pelvic floor trigger point into the transverse perineal muscle of like a male patient. And again, patients were very understanding because I was very transparent, not suggesting we do that for everybody for all sorts of stuff, but just saying mentorship can also come in different forms of my patients being like, but we appreciate you for trying. We know that you went to this workshop that you were really excited about, and now you're coming and doing it. So we'll tell you how it goes and we'll tell you how it feels, and help me navigate. Does it work? How does it work? What can I change in my practice? So solidifying mentorship to me means knowing that mentorship comes in many different ways as we evolve through our careers, and being able to have that adaptable mindset. And then there was one other question that you asked I was just about to answer, but for me, mentorship comes in many different ways, and being able to evolve our practices around it. Oh, yes, the pipeline. So pipeline, right? So we have that sort of metaphor that we've used for women in medicine, where we have the pipeline effect of women sponsoring other women and being able to navigate up the career chain. That's important too, for all of us around us to know, like Jordan, you said, rising tides raise all ships. We can't do this alone, and we shouldn't do it alone, because we're all going to need each other at some point. So knowing that right now as a fellow, you may be turning to us and being like, wow, like, they seem like they've had it all figured out, and just constantly being like, okay, we're going to evolve to there, but don't forget to lift and raise the people around you, because you're going to learn from those relationships too. I tell my medical students that I learn from them all the time. These medical students are getting younger and younger, and they bring a fresh, different perspective. And they stop me in my tracks sometimes where I'm like, wow, I didn't even think about that. And then we look it up together, and then we talk about it, and we have a discussion, and I learn from my medical students. And it's just having that open mind of knowing that you can learn from anybody. Anybody can help you, but you can also help anybody else, and having that mindset.
I love it. And I love how you mentioned your patients as mentors as well. Really good. All right, I think we have a couple more slides and a few more minutes. If anybody has any questions, put them in the chat box. Q&A.
Or anything they want to share, that has been impactful to them throughout this mentorship series. Again, we have to thank our sponsors, SPR, for sponsoring this event tonight, and for being so wonderful in facilitating this gateway therapy, as we call it, for many women in our space, and continuing to support our practices and our patients.
We look forward to seeing you all in Scottsdale in less than a month. So pack your bags. Pink suits are encouraged. And hopefully you have a fun outfit for the gala on Saturday night that is raising money for Hope Charity. So thank you guys for your time and attention. Thank you, Dr. Alopi, for being our guest this evening. And we hope you all do well, go out and mentor and mentee and absorb and pivot. And we look forward to hearing your letters on Sunday.